Welcome to week 5. We are covering chapter 6, body composition. After this chapter, you should be able to identify what fat-free mass and body fat is able to describe in their functions in the body, explain how body composition affects overall health and wellness, describe how body mass index, body composition, and body fat distribution are measured, explain how to determine recommended body weight and body fat distribution. So we have two different fats. We have the fat-free mass and the body fat. Fat-free mass includes your bone, water, muscle, connective tissue, organ tissue, and teeth. Body fat includes your nerves, brain, heart, lungs, liver, mammary glands, and other body organs and tissues. Of course, a certain amount of body fat is essential for your body to function. Excess body fat, however, is associated with increased risk of chronic disease, like diabetes and chronic disease. We have 4 different fats. We have the essential fat, the fat that the body needs to function, adipose tissue, which is the fat cells storage, and subcutaneous fat, which is located under your skin, and visceral fat that is located usually around your major organs, and also could be called intra-abdominal fat because that's where it's easiest to transfer the fat to other places. This is just a typical composition of 20 to 24-year-olds, men and women. As you can see, men have greater muscle, which is 45%, and women have 36%. Essential fat, however, is different from men and women, which we will go further into this chapter. Bone is 15 in men and 12 in women, and other is comprised equally of 25%. So when you're looking at body composition, the most important is for you to consider the total body weight of that is fat, so the percent body fat. We have overweight usually at about 25 to 29.9, and obesity is over 30. The prevalence of obesity has increased since 1960s to 2016 to even 2020 now. The majority of increase occurred in middle-aged and older adults, but has impacted all populations almost equally, both in men and women, socioeconomic groups, age groups, and also where your environment is. So are you in the city or you're in the countryside, has impacted people equally. So the shift from 13% in 1960s to almost 70% in 2020 is due to possible increase in different lifestyle changes, because nowadays fast food is has shown to be greatly consumed by all people. There's less time doing active activities or even have an active workplace. So a lot of the times people sit in offices, are very sedentary. We have less time to dedicate to fitness and overall wellness due to all of these factors, like sitting in traffic or being in different activities. This is the obesity trends between adults and young children from 2 to 19 in 1999 to 2016. As you can see, adults and youth have both increased throughout the years in their obesity rates. Excess body fat and wellness. As rates of overweight and obesity increase, so do the problems associated with them. So obesity doubles the mortality rates. So you can expect life expectancy reduction by 10 to 20 years. I'm sure everybody's aware of diabetes. We have type 1 and type 2. So diabetes really disturbs the normal metabolism. So it interferes with making insulin. And because there's not enough insulin to take out the glucose from the bloodstream, the glucose causes a buildup. And this is the 7th leading cause of death in the United States. Of course, there's due to the fact that there's different diabetes types. Type 1 is usually genetic. Type 2 is due to your environment. So it's a key controllable risk factor from type 2 diabetes. Obesity is correlated with metabolic syndrome, which increases risk of heart disease, diabetes, and other chronic illnesses. You just need 3 out of 5 of these factors in order to qualify for metabolic syndrome diagnosis, which is large waistline, high blood pressure, high fasting blood sugar, which is due to insulin resistance, high triglycerides, and low HDL, which is actually good cholesterol. Insulin resistance occurs when cells do not respond normally to insulin and cannot easily absorb the glucose from the bloodstream. There's 2 conditions that are associated: the chronic inflammation, which is a response of blood vessels to harmful substances, germs, damaged cells, or irritants, can lead to heart disease, cancer, allergies, and muscle degeneration. Then also fat liver, which is increasing fat storage in the liver, and it can occur in liver inflammation and failure. Metabolic syndrome is associated with risk of heart disease, and more so in men than women. About 34% of adult Americans have metabolic syndrome. Obesity is also associated with risk of death from many types of cancers, along with other significant health problems. The distribution of fat, so where does the fat located, is an important indicator. So men and postmenopausal women usually develop the apple shape, which is storing fat in the upper regions of the body, particularly in the abdominal area. And abdominal fat may be easily mobilized and sent to the bloodstream, increasing disease-related blood fat levels. A measure of waist circumference helps assess risk of unhealthy body fat distribution. Too much body fat makes physical activity difficult and generally discourages people who are overfed for exercising because it's difficult to run or do extraneous activities. Emotional wellness and self-image are, of course, correlated with how you see yourself and your body image. However, instead of being overweight, we also have been adapted to an idea of underweight is what is ideal, but that is also very unhealthy. Having too little body fat is actually very dangerous. For women, it's around 8 to 12, less than 8 to 12%. For men, it's less than 3 to 5%. And extreme leanness is linked to reproductive, respiratory, circulatory, and immune system disorders, which could lead to premature death. In women, especially in women athletes, for example, gymnasts, they can experience amenorrhea, which is absence or infrequent menstruation, and also could lead to loss of bone mass. There's different methods of assessing and classifying body composition are based on the body fat. Others are based on total body fat. Assessments can provide information of health risks and help establish reasonable goals. So we have BMI, which is body mass index, usually just a measure of your body fat, so body weight in comparison to your body height, and a BMI between 18.5 to 24.9 is considered normal and desirable. It's important to also consider bad fat distribution and other disease risks. So measuring your waist circumference is one method of assessing body fat distribution. This is just a general map. There's maps for women and men, but this is just a gender neutral map. So underweight is anything 18.5 and lower. And then there's different thinness indexes. Normal is between 18.5 to 24.9. Overweight is 25 to 29.9. Obese class 1 is 30 to 34.9. Obese class 2 is 35 to 39.9. And obese class 3 is anything over 40. As you can see, waist circumference, it also differs from men and women. What is normal? So normal is 32, and then anything under 32 and anything under 37 in men. But BMI doesn't distinguish between your good fat and then your bad fat. So it's only an indirect measure of body fatness. There's also several other factors influence the relationship between BMI and actual percentage of body fat, which is your muscle mass. Maybe you have more muscle mass than actual fat, age, sex, race and ethnicity, and height. BMI is actually a very poor predictor for people who are short, so women under 5 and men under 5'5". There's different ways of estimating body fat, one of which is a bod pod, which, as you can see in this picture, is just a little chamber, and it has different sensors that measure body composition by air displacement. Next, we have skin fold measures, which you have the little measuring device, and you see how thick are your skin folds. We have the BIA, bioelectrical impedance analysis, which sends small electrical currents through the body, measuring the body's resistance to it. And also we have advanced techniques that are very expensive, but MSU has these measurements. So one is dual energy X-ray absorptiometry, which works by measuring tissue observation of high and low energy of X-ray beams. And then the other one is the total body electrical conductivity, which estimates the lean body mass, which by passing the body through a magnetic field. So for this chart, let's just focus for people in your age group. So women 20 to 39 and men 20 to 39. And there's different body fat classification. So essential, as we talked about before, 8 to 12 for women, and men is 3 to 5, but anything below that is unhealthy. Low athletic is 13 to 20, men 6 to 7. Recommended for health of your total body is 21 to 32 for women and 8 to 19 for men. Overfat is 33 to 38, 20 to 24 for men, and obese is over 39, and for men, it's over 25. Waist circumference measure and waist to hip ratio calculations are the simplest assessments to perform. You can do it at your house. Total waist measurements are more than 40 for men and 35 for women, and waist to hip ratio above 0.94 for young men and 0.82 for young women are associated with increased risk of heart disease and diabetes. There's different types of body build. So we have the endomorphous, which is the round, pear-shaped, wide hips and shoulders. Mesomorphs, which are lean and muscular, and they respond well to exercise. Ectomorphs are thin, linear with narrow hips and shoulders. So if you were and told that you need to lose some fat, you should set realistic goals because there are gene limits of what you could do, but you could definitely improve by regular exercise and healthy diet. Of course, focus on your lifestyle, so make sure that you are having a balanced lifestyle of exercise and eating healthy. And let's test your knowledge. So, does exercise help reduce the risk associated with overweight and obesity, even when it doesn't result in improvements in the body composition? So, yes, regular physical activity provides protection against the health risk of overweight and obesity. It lowers the risk of death of people who are overweight or obese, as well as those normal weight. So, number two, what is the most significant controllable risk factor for the most common type of diabetes, which is type 2? And if you can remember, it's being overweight or obese. Other controllable risk factors include smoking, low fiber diets, and inactivity. Estimate about 90% of cases of type 2 diabetes could be prevented if people adopted healthy lifestyle behaviors, which is very important for children because recently a child of, I believe, 5 years old was diagnosed with type 2 diabetes, which is very, very young in comparison when we were a couple years, the earliest was at 15 years old. And number three, what are some potential consequences of excessive exercise and low energy calorie intake in women? So, very low levels of body fat and behaviors used to achieve them have severe health consequences for both